Welcome, everybody, to the International College of Integrative Medicine podcast, translating science to clinical practice since 1983. I'm your host, Luke W. Russell, and I am joined by Dr. Elizabeth Vaughan. Dr. Vaughan, thanks for sitting down.
Thank you, Luke. Good to be here.
So could you tell me a little bit about how what your practice is today and how it's transformed over the years?
Well, absolutely, but it's very different today than it was because I really closed my office practice. As much as I enjoyed touching people, I think that when we touch people, that's sacred.
Yes.
It's healing.
Yes.
And I miss doing that, but I got sick.
Yeah.
I have needed integrative medicine just as much as my patients have for many, many years. And I am now doing a consultative practice from my home in my upstairs bonus room, which is also my office, and still taking care of patients by phone. I no longer actually have an office because I got sick from black mold and Aspergillus fumigatus and Cheetomium, 3 different toxic molds last year.
Yeah.
And fortunately, I knew other integrative physicians, and I'm an integrative physician. In fact, I used to be the mold doctor in the metropolis of Greensboro, North Carolina, where I live.
Yeah.
But I was making mistakes, I was getting sick, and my brain just wasn't working very well, so I had to close my practice in January. And I started an aggressive cleansing program, took 6 months off, and now I've come back and I've started just talking with patients over the phone.
Yeah.
But I have had my own issues. I have had problems with mercury toxicity. I got some lousy genes from my parents, unfortunately. Thank you both. It's all good. It's made for a very interesting life. And I have a number of other things that I've had to deal with, food sensitivities, et cetera, et cetera. So so I needed integrative medicine as much as my patients ever did.
Yeah. What over the last couple years, what kind of new knowledge have you been uncovering with your patients?
Oh, I learned something from patients every single day. I mean, patients pushed me into integrative medicine.
Yeah.
Let me tell you how I got into it in the first place.
Yes.
Because this was back in the mid-1990s, and I'm board certified in internal medicine and emergency medicine. And I had been running an ER, then I opened up an urgent care center in the metropolis of Martinsville, Virginia. Yes, that's the one with the speed, the short track, NASCAR sport short track. And I had a diet program going as part of that office. And it was a very progressive, well-rounded diet program based on my being an allopathic physician.
Yeah.
And the diet du jour in the mid-90s was Dean Ornish's 10% fat diet. And I could get weight off of people doing that. They would lose the moons, which is a reflection of your healthy fats. Their hair would start falling out, but I could get weight off of them. Now, I couldn't keep it off of them. And I had people who just did not respond.
Yeah.
Not all of them, but a few of them that just didn't respond. You always learn from the outliers. You learn from the people that don't respond to what you're offering them. And so one of them came back in for a weekly check, and she brought a book with her, and she shoved it in my face, and she said, "Have you read this book?" And I looked at it and it was kind of like, "Eat Right for Your Blood Type" by Dr. Peter D'Adamo. And I said, ND. I had no idea what an ND was back then. And he was a naturopathic doctor. And I said, "No, I haven't read it." And she said, "You were telling me to eat all the wrong things. I have O-type blood. Wheat is a toxin for me, and I cut the wheat out of my diet, and I lost 11 pounds this past week."
Wow.
That dropped my jaw. It humbled me. I realized how much I needed to know. Now, I've never been a real arrogant person. I'm not a real arrogant physician. But I realized, oh my gosh, there is so much more information out there that I haven't tapped into. And so I stopped going to conventional medicine, continuing medical education courses, started going to naturopathic education courses, and I was in that second generation. I'm 65 years old. I was in that second generation of physicians that started bringing integrative medicine into daily life, into practice back then in the mid-90s.
Wow.
It was wonderful.
And how do you feel like, as a physician, over the years of work, how have you transformed as a physician?
It just doesn't stop. You keep on learning.
Yeah.
People who are integrative physicians, they have to have energy because there's always something new to learn.
Yeah.
And there's always a different twist on it. Patients demand that we keep on learning. I mean, I have a whole library shelf of books that patients have given me and said, please read this and take care of me.
Wow, yeah.
And so, and I think the biggest change that you make as an integrative physician is that you are absolutely treating the whole person. Mm-hmm. You are treating the underlying causes of what's causing their symptoms. You take time with patients. I mean, I spend an hour to an hour and an hour and a half to 2.5 hours with a new patient when they were in my office.
Yeah.
And I'm basically getting them from conception all the way through to where they are right now. What are all the things that have impacted this person that I am seeing in my office?
Yeah.
And so what are all the different influences that brought them to where they are right now, and the illness or lack of illness? I mean, I have some people who come to see me because, hey, I feel good. I want to continue to feel good.
Yep.
Great, I can help you.
Yeah.
And then I have train wrecks come in, and they're all welcome.
Yeah.
They're all welcome. But I have learned so many life lessons. I think one of the other things that you learn very, very quickly is most of us, not most of us, every single one of us, there are things that we have too much of and there are things that we have too little of.
Yeah.
So many people don't have enough nutrients for a whole list of reasons. Most of us have way too many toxins on board for a whole list of reasons. And so integrative medicine is about helping us rebalance that.
Yeah.
And making so that our bodies, our minds, our spirits, our emotional mind can flourish.
What has there been any particular focus in the patients you've been working with of late?
I have mainly worked with people who had weight problems, problems with blood sugar. I treat a lot of people with diabetes or pre-diabetics and teach them how to eat. And help them lose weight, because that's the way to avoid becoming a diabetic. It's not taking all these drugs. Drugs can be very helpful in the right person, but so much of it goes back to your lifestyle. And do you exercise? Do you sleep well? Do you enjoy sex? What kind of things do you eat for breakfast and throughout the day? That kind of thing. So you have to address all of those things.
I'll be back with more from Dr. Elizabeth Vaughan in just a little bit. First, let's listen in to what our Executive Director, Wendy Chappell, has to say.
Hi, thanks, Luke. The International College of Integrative Medicine is a community of dedicated physicians who advance innovative therapies in integrative medicine by conducting educational conferences, supporting research, and cooperating with other scientific organizations while always promoting the highest standards of practice. That is the mission statement that is going to greet you when you go to our website, www.icimed.com. But there's more. Our founders wrote in our bylaws that they wanted to establish an organization composed of qualified physicians and other qualified healthcare providers who are engaged in the practice of medicine or medical research in emerging standard, alternative, complementary, and innovative fields of integrative medicine and preventative medicine. They basically were looking for people on every corner of the spectrum to find the research and the practice that worked to help their patients. And we still do that today at every conference, at every conversation, at every discussion that we have about standard of practice. We are trying to find the very best treatments for our patients. Join us at integrativemedicineconference.com and come get to know us at our next meeting.
Awesome. Thanks, Wendy. Now, let's get back to my interview with Dr. Vaughan.
What would you say to your fellow physicians when it comes to taking care of themselves?
Do more of it and do it well. I'm laughing because I have some health issues right now, and it's because I haven't taken good enough care of myself.
Yeah.
And I think especially integrative physicians, we have this incredible passion for taking care of other people and helping them, and so often we don't take care of ourselves, and we need to. And so I'm going to be pausing my life for a while to get myself rebalanced. That's what I'm doing right now, and not working as hard as I did before. And I know I am going to a bigger and better place, and it's going to be exciting. Every single time I have gotten sick, whether it was mercury poisoning or food sensitivities, or more recently this mold illness that I had, any of that, all of that makes you a better physician. It's an opportunity to learn and to expand what's going on. So it is when my mother started showing signs of Alzheimer's in her mid-60s, I didn't know I had mercury toxicity back then.
Yeah.
No one had had Alzheimer's disease in my family, no dementia at all. And it was kind of like, what are you doing, Mommy? But she was not the woman at 65 that she should have been.
Yeah.
And I did some gene testing on myself, found out I can't get rid of mercury. And I had a mouthful of silver fillings that are 51% mercury. And I knew I'm going to be where she is in 20 years. We're getting these babies out.
Yeah.
We're going to chelate out the mercury. And then I found out, I had lots of lead and cadmium because I had lived in a smoker's environment, and I smoked for 10 years myself. We're not above indulging and doing bad things. We're quite human, and that was one of the things that it's so funny because I don't think of myself being an arrogant person.
Yeah.
But I had been chelating other people in my office in Martinsville. I'd been chelating patients for some time. Not once did I think that I would benefit from it.
Oh my goodness, yes.
Until it was in my face, that, this is an issue for you.
Yeah.
And all of a sudden, my chronic long-term fatigue got better. My depression got better. All kinds of things. All of a sudden, I was able to manage my weight, which I hadn't been able to do.
Yeah.
All of that. I mean, I didn't have a Prozac deficiency. I had mercury toxicity.
Wow.
Yeah, just fascinating. And very humbling and fun.
Yeah.
And fun.
So, looking ahead, what's next for you?
I'm going to write a couple of books. I'm in the process of writing a book right now about how medical illnesses interfere with sex and intimacy. And because I deal with that all the time. Yeah. You asked me what kind of patients I take care of, and it's men and women, primarily middle-aged. And many of them are beginning to feel their age. Yeah. And I can give them more vitality. I mean, they got to work for it.
Yeah.
It doesn't come on a silver platter. But if they do the things that I tell them to do, or my health coach tells them to do, they get better. Yeah. They feel younger, and they age much more gracefully. It's not a matter of not getting old. It's not a matter of, not dying. It's a matter of let's add more life to the time we have.
Yeah.
Yeah.
Now, how long have you been around here at ICIM?
Probably 12, 13, 14 years. Yeah.
And how has being a member affected you as a physician in your practice?
Oh, it's just been so stimulating. And ICIM is a very warm family type organization, as opposed to being a massive group like A4M or IFM, etc., and which have their place. But for me, it's more fun for me to go someplace where I know just about everybody, and it's just like old home week.
Yeah.
I mean, these are my brothers and sisters.
Yeah.
These are the people we have all had the target on our backs. All of us have generally been reported to the medical boards. All of us have had to defend what we do, and so we have that in common. Where most physicians, conventional physicians, don't experience that.
Yeah.
Yeah.
Yeah. What do you feel like? How can you? How do you feel like that's kind of affected you being part of the ICIM world? How do you feel like that kind of affected you as a physician, like a before after kind of thing?
Gave me more confidence. And gave me even more perspectives, and gave me, as opposed to theoretically how do you do this, it's really more nuts and bolts. How do you get patients to do these things?
Yeah.
And at the same time, that just ICIM hammers on us in terms of physician. We have to take care of ourselves.
Yeah.
And it takes a village to take care of us too.
Yeah. Are there any particular events in the last 12, 14 years that being part of the ICIM world helped? It could have been like maybe a particularly tough case, or maybe just like when you're adding a new therapy to your office.
That's not a fair question because I'm still recovering from my mold illness and my brain's not that great.
Okay.
And my memory's not that good.
Okay.
What I can tell you is that in general, I have someone to call if I have any questions about patient care. If something comes up and I feel like I'm a little bit out of my league, I have someone that I can call that can help redirect me or give me the courage to say, I need to send you to somebody else.
Yeah.
I can't do this for you right now. I'm not the right doctor for this particular problem for you. Okay? So they're there for me. I would say that more than anything else.
That's wonderful. Well, thank you, Dr.
Thank
Vaughan.
you so much,
Thank you so
Luke.
much for sitting down with me.
Thank you. I appreciate it.
Such a delight.
Thank you. Have a good day.
Thank you.